Marion is an exceptional scientist, internal medicine doctor, a pioneer, a writer, but above all, an exceptional human being. So I'm so proud that we are going to be able to listen to her, because we do have the problem in the other room. And let's take, okay, they'll let you know over there.
Well, you have to be ready for any occasion, I always say. I feel a little out of place listening to all of you concentrate on prostates and the bladders of men, because I really come from a sort of different perspective, which is gender-specific medicine. And so it was difficult to decide what would interest all of you. And I decided to talk about AI and the database, quantifying human variability with a sense of security that the data that you acquire or that you send to AI is appropriate and complete and accurate. There is no assessment of AI that does not include, in the first sentences of its introductory paragraph, the pivotal importance of the databases used to construct the AI algorithm. The quality of the databases, particularly with reference to a consistent use of clearly defined terms, assures the reliability and viability of AI output. If there are significant discrepancies in the terminology of the database, or in the inclusion of significant variables that might impact the data, AI's offering is flawed. The actual implementation of the requirement for carefully structured investigation that defines its terms and considers all the variables that might impact the hypotheses being investigated is not at all simple. With regard to the studies that have been reported to define the significant differences in men and women's normal physiology, their response to the same diseases, a stunning inadequacy of protocols has been reported. In most expert reviews, flawed studies reached as high as 70%. Mismatched groups with regard to age, race, and other variables, as well as numbers inadequate to document statistical differences, are among some of the most prominent deficiencies. Generating an accurate database about sex differences may have two impediments. First, the clinician scientist who has no consistent definition of sex and/or of gender. And second, the individual subject. There is no universally accepted description or inclusion of the variations in sex-specific biology or sexual orientation and function in the flawed electronic health record, which is the basis of most of the data, if not all, given to the AI instrument to generate differences between the sexes. I love this picture of Pandora opening a box, and it's very much an allegory of what we are thinking about when we decide what we're talking about when we talk about sex and gender. And there is probably no term or terms more confusing in current scientific literature than sex and gender. Almost invariably, the two words are conflated in the manuscript that you're looking at, and it's conflated as sex/gender. The reader is left to conclude that the two nouns are interchangeable, or that somehow, in some manner, they are different but interrelated. The definitions of sex, and much more frequently gender, are so diverse as to make the term a catch-all for an incredibly heterogeneous concept. The theme of this presentation is to explore how reliably AI can illuminate real difference in the impact of genes and hormones on human biology, and in addition, how the experience of the individual human over the course of a lifetime modulates those differences. In fact, an AI analysis of post-genomic data suggests that the human, at any given moment of the lifetime, is a construct of biology modified by experience, and that the proper term for that human is a word that reflects the concept more precisely, namely the biosocial organism. The linear 20th century model of sex was that it was a simple binary in which the sex chromosomes functioned to produce either the testis or the ovary, and they in turn produce hormones that act directly on tissue to affect functional sex differences. And to quote Richardson, this serial model of sexual differentiation was simplifying, unifying, and seductive. Richardson has urged a completely new view of the sex chromosomes, not only as the genesis of all differences between males and females, but essentially as containing the switch that sets off a complex system of sex-specific differentiation. She points out that many of the genes involved in the process reside on autosomes, and that the genome interacts with hormones and environmental experience in a complex, dynamic, and constantly changing milieu throughout life. Arnold introduces the new word, the sexome, which echoes Richardson's view. He emphasizes how the complex and constant interplay between hormones, genes, and the epigenetic factors that modify gene expression. The sexome is a much more inclusive term that describes how all the numerous factors, genetic, hormonal, and epigenetic, interact to produce or eliminate sex differences. Importantly, the sexome incorporates the impact of environmental experience on the individual's biology. That impact is multifactorial and furthermore may not be fixed and may vary over time. So when you are weighing the adequacy of the individual studies, first, consider some variations in sexual development and differentiation that might not be evident and/or clinically clearly defined. And second, has there been careful attention paid to the impact of specific environmental factors on gene expression in the protocols? Sex can be much more complicated than it at first seems. That's sort of the quote of the day. Sexual orientation is largely based on self-report and impacted by environment and culture. Those who view homosexuality positively postulate that a small percent of people are so because of nature rather than of external factors. Those with a negative view assume that it is socially contagious. The first assumption is much more likely. Differences in behavior or gender nonconformity often are apparent in early childhood long before sexual orientation, and the behavior continues despite socialization and the most extreme attempts to enforce gender conformity fail. Gender identity is a subjective internal sense of being a woman, man, and/or another gender. Gender identity can be fluid and change over time. Gender terms abound: cisgender, transsexual, transgender, gender nonconforming. Changes in gender identity are common, and especially in women. We then have to consider also differences in sexual development. Sex development involves sex determination, that is, the formation of testes or an ovary, and subsequent sex differentiation. Disruptions in the complex genetic process that promotes differentiation of gonadal tissue into a testis or an ovary produce a DSD, so-called difference in sexual development, a variation of differences. DSD is not monogenic. Mutations on multiple genes may not only lead to the development of one disease, but also to multisystemic lesions. Patients with multiple abnormal manifestation in multiple systems should be followed in the clinic. This is related to prognosis and is an important factor for gene therapy and for genetic counseling. Patients with poor gonadal differentiation have an increased risk, for example, of germ cell tumors. So how well are we doing in assembling the data about individual patients to submit for the manipulation of AI? In 2022, the National Academy of Science, Engineering, and Medicine provided baseline recommendations for data collection. The data promotes high-quality patient care and facilitates more accurate assessment of self-reported health and behavior. The data can be used to notify healthcare agents of appropriate and targeted care and preventive services. And finally, the data can be combined with other data regarding social determinants of health. And as this slide indicates, of 90 centers in a geographically diverse survey, only a little over half provided for documented sexual orientation and only 61% for documenting gender identity. Not one electronic health record platform collected all the data as defined by baseline recommendations or had questions about developmental variations in development or intersex status. Most frequently excluded were organ and anatomic inventory. So here are the suggestions for change. We should standardize the electronic health system definition of terms and expand the selection beyond the binary of male or female. The patient definition of what he or she feels is the gold standard, and at least these questions should be included. What is your gender identity? And then ask, what is your assigned gender at birth? That brings a little organization and clarity to the data collection. And then accommodate space for further classification. There are difficulties with clinical decision-making on the basis of organ inventory, which is the sine qua non of gender identity. The tissue composition may not be clearly demarcated as in the ovotestis. Some features may develop unexpectedly. Some organs or tissues might be partially present in certain situations, and some organs be unanticipated. So as you see, this is a very complicated situation. Well, how is biology related to the environment? As my colleague from Canada, Gillian Einstein, put it, the world writes on the body to produce this new term or concept, which I think is more accurate, the biosocial genome. Sex and gender are literally inseparable and co-constituted. There are no genetic factors that can be studied independently of the environment, and there are no environmental factors that function independently of the genome. At no point in life is the operation of the genome independent of the context in which it functions. The impact of the environment on gene and post-genetic elements and the expression of post-genetic elements is inevitable. There are epigenetic effects on the action of genes and post-genetic elements' actions, regulation and repair, some of which are heritable. So ask these questions. Do individual tissues have sex differences in which genes are expressed in response to environmental experience? Are there sex-specific genetic pathways in the integration of environmental events into physiology? And what is the degree of sex-specific heritability of environmental elements in the phenome? So, to conclude, the complexity of the environmental impact is enormous. An environmental factor, nutrition for example, is not a simple exposure in isolation or a function of individual choice, but a resource that is constrained in complex ways by social and structural factors that distribute resources and chances of health unevenly across society. So replacing the view of sex and gender as separate concepts is the, I think, ultimate aim at which we would like to achieve. The approach of the investigator should be to avoid simplistic binary categorizations of the subjects and to acknowledge and explore the environmental factors like culture, economic position, education, etc., that coexist and impact the phenotype. Complexity-affirming approaches do not require acknowledgement of all variables, but a careful framing of the research protocol to create both a feasible and reality-oriented design. Gender and sex entanglement signifies that gendered experiences inform the development and functioning of biological systems, including sex-associated traits. Clearly, environment and experience have a profound, important impact on function. How can we measure that impact on the phenotype? And will the impact of the same environmental entity be identical for both males and females? And this is my last slide. Conceptualizing or operationalizing sex and gender entanglement, there is no tidy answer or a one-size-fits-all. There is difficulty in bridging diverse disciplines. There is difficulty in universalizing perspectives across cultures, geographies, or time zones. And finally, there is substantial divergence and dissensus in how to resolve this central issue in research, which, quote, accurately reflects the messy, complex reality of sex/gender entanglement in human life. Anyone who claims to have a neat and tidy answer to a complex set of questions like this is probably wrong. Thank you.
Thank you, Marianne.
Thank you.
Well,